Acts, 3 o'clock, House Healthcare. We're joined by Brina Holmes, and I will just say that tomorrow is dedicated to we have various organizations, interested parties coming in tomorrow around budget asks, perhaps things that were not in the governor's recommend, but that we should hear from. And we're starting this afternoon with Brina Holmes. So if you want to go ahead and introduce yourself and get started.
Great. Thank you so much. I'm so happy to be with you this afternoon. I'm Brina Holmes. I'm a general pediatrician. I'm the American Academy of Pediatrics Vermont chapter president. And I may look familiar to some of you because I was the maternal and child health director at the Vermont Department of Health from 2010 to 2021. I'm here today to speak to you about the need to continue that blueprint expansion pilot, but I want to give particular attention to the proven primary prevention approach that's within that expansion called DOLCE. And DOLCE stands for Developmental Understanding and Legal Collaboration for Everyone. And I'm going to tell you a little bit more about it in a few minutes. But this expansion pilot, the whole pilot in general, has been an incredible support to primary care. And we really need to continue to provide that necessary funding because the focus of the pilot was on mental health and substance use. And because I've delivered primary care and I know what it feels like out there, I'm very well suited to talk to you about it today. I know you all know that there's a high number of patients ongoing, both children and adults in Vermont, seeking mental health and substance use care. And a lot of that is falling to primary care, which is a really good place for that. However, without adequate support in primary care, we don't have enough psychiatric beds, as you know. Our emergency departments are overrun. And this pilot was really stabilizing to put more support into primary care for mental health and substance use. If you want to see more about that, and it sounds like you'll hear more tomorrow, there is a link in my submitted remarks that shows all the data and what was going on with the pilot. But what I really want to talk to you about is DOLCE. So for those of you that were here 2 years ago, you may remember that we added in the existing approach that we had been working with since 2016 into the blueprint expansion because it made sense in the primary care support. So DOLCE is set up to promote optimal health of brand new babies and families. And it's really a response to how can we find out early about the health-related social risk or social determinants of health that are impacting our new families. And this is a rare and universal, truly upstream approach in Vermont. I know that a lot of people say they're upstream and they're doing primary prevention, but this DOLCE approach targets just the brand new babies, the brand new families. And so while we were really hoping the governor would include it, there is some talk of carryover funding, but that really is unclear. And we know it's not going to reach the DOLCE practices, of which we have 9. 6 practices are using the blueprint funding. And what I wanted to make sure everyone knew, that wasn't new in the pilot. We've been doing DOLCE since 2016. And I wanted to tell you that story because it's a good Vermont story. So we were looking for a solution in 2016 that would bring the expertise of parent-child centers to pediatricians and to add in a legal partner, recognizing that a lot of the challenges facing new families had a legal aspect, whether it be about Medicaid eligibility or your housing rights or what was happening in communities. So we found, thanks to somebody named Scott Johnson, who some of you may know, he was the director of the Lamoille Family Center, which is a parent-child center in the Lamoille Valley. He found this DOLCE approach, brought it to me in public health, and we worked together to launch. And at the time, we did what we always do in public health. We were braiding and blending funding. We had some private foundation. We used some public health dollars. At one point through the last 9 years, the OneCare ACO provided some funding, and we hung on as best we could. And so we were so thrilled when it was included in the blueprint because it had been working and we had great data and it felt like very secure funding. So here's what Dulce does. It's just acknowledging that the beginning of a family's new journey with a baby is loaded with predictable stress. And nothing about a person's circumstance is considered. It's about all new babies. And it's acknowledging that there's a unique opportunity in infant care where we know that the emotional and relational foundations of a child's life are being laid down in those first 6 months at a time when parents are experiencing a ton of stress and also a lot of unmet needs. So the family specialist in Dulce meets all the new babies, works with new families to figure out what community resources would be helpful and how can they support the bridging of that at the earliest possible time, which is the beginning of life. So what we know in Vermont is that we have the highest rate of well childcare of most states. So the medical home is a great opportunity to meet the families in that safe environment. We have multiple well visits in that first year, and that in the routine healthcare, it's pretty much accepted by families that we're going to be asking hard questions about what's happening with a family, both in the social need arena, but also what are parents experiencing in their mental health challenges and their substance use challenges in the context of a new baby. So it has this two-generation opportunity. So this is why we love Dulce. It has been shown to improve the work life of the healthcare professionals. And I know that your committee cares about that. The workforce is in trouble. Pediatricians are not doing well. It's a very hard time to deliver healthcare. And Dulce is a solution that makes pediatricians go home at night feeling like they've supported families in a more satisfying way. We also love Dulce because it's innovation in delivery. It actually has the family specialist in the exam room with the doc or the nurse practitioner. And that family specialist does the joint decision making with parents and says, yeah, the doctor's busy. He's going to go to the next room, but I'm going to stay with you and talk through a little bit more about that question you had. So it's got this collaborative spirit that we've really seen benefit from. I know you guys care about outcomes and population health, and when you use Dulce, it's an earlier opportunity to connect families to the services and resources they need. What we're finding in our data is it's mostly basic needs. It's the beginning of life for this new baby. It's food and housing and understanding what their opportunities are for connection and community. And then the last thing, I was going to lead with it, but I'm going to end with it, is controlling costs. As a healthcare person, I really, really know that it's spiraling and it's very expensive to deliver healthcare in this world. But this is not an expensive approach. And this is the acknowledgement that if we can make an investment in these first 6 months with these new babies' lives, we are going to save so much money in the long run. The national work on Dulce shows two very important things. These families do not go to the emergency department, which is expensive. They don't go to the emergency department because they feel that they have that safety net of this family specialist in between visits with the physician or the nurse practitioner. They also increase their use of well visits, so they come in when they're supposed to get the prevention efforts, and they have higher rates of immunization, which of course matter so much. So I just wanted to end with two quotes. One of the pediatricians in the Dulce world in Vermont said, "This is why I became a pediatrician, to address the things that really matter for families and children. And through Dulce, I can." And then one of our families said, "This program's made me feel safe, heard, supported in every way. Our family now has the opportunity to thrive in the face of chaos that is our life at present." And then the last thing I'll just say, I see your hand up, Representative. Thank you for that. We so appreciate this committee's commitment to primary care and prevention. I think that those words are used a lot. We talk all the time about prevention, and I'm really excited to be able to tell you about something in my 30-year career that really works. And we need the continuation of that pilot funding to keep primary care seeing patients with the mental health and substance use disorders, as well as working in this new baby space. And as we said, it's a little confusing that the governor said there'd be some carryover, but there really is no funding allocated for Dulce. We are all very concerned because we've been doing it for 9 years, and we're grateful for your time today. Uh, and I'm ready for some questions.
Mari, do you want to go ahead?
Sure. Thank you, Dr. Holmes. Love the work that you do. I love Dulce. I read your testimony that you submitted, and I'm wondering if you have a number you can give us, a suggested amount that would be helpful for us to work toward in the budget, or if you can get a number to us.
I will get that to you. I try to stay out of numbers because I tend to miss opportunities to say what we really need. When you work in public health, there's sort of a shoestring, and then there's the way it really works best. So I will get that to you. Thank you. And I also want to do it respectfully within the context of this house, the blueprint that we're living within, because we're really grateful that they stepped up a few years back and were willing to take this in as part of their package. So it's really not a separate ask, it's within the context of the blueprint expansion.
Thank you.
Can you remind us to Representative Cortes's question? So if I recall, there was an expansion of the blueprint, which I think was grant funded. And if I recall that a lot of it was going to sort of the expansion of substance use treatment.
Yeah, so I'm gonna give you my best.
Dulce in the mix.
Yes, yeah. So
And
it wasn't grant
years?
funded. The pilot was Medicaid, and again, others would be much more skilled at describing. But the pilot was the idea that if it worked in Medicaid, then the all payers would come in, and this got very complicated, as you are probably grappling with the Vermont's decision about the AHEAD model. So there's this gap now. But what we were able to advocate for, so that was the pilot was really in service of how primary care is showing up for patients with mental health and substance use disorders. But we always look as Dulce leaders for the potential for the prevention of all that in infancy. So we were able to tack it in. And I think what you might be wondering about, and I didn't want to overcomplicate today, one of my shortcomings is overcomplication. Because we have never had adequate funding for Dulce, we have a blended funding still. We have federal grants that help us with some sites, and then Blueprint was able to help us with 6 sites. So we have 9 total, and 6 are in the Blueprint, were in the Blueprint budget.
So three are using federal funds, 6 were in the blueprint.
Exactly.
And in governor's recommend, there is this carryover, this gap, this funding, but you're not sure that any of it's going to Dulce. I'm sorry.
I'm actually pretty sure it's not going to Dulce at all, because it was also used for human resource community health team members that are helping pediatrics with 10-year-olds and 14-year-olds and mental health consultation and coordination. So we've been told the carryover is not heading to that primary prevention space,
Right.
because it's needed elsewhere, if there is any, and there's been a little bit of confusion there.
And I'm looking to Representative Houghton to.
My understanding, but we'll probably want to get JFO to confirm. So there were 2 things going on. There was the blueprint that we funded for 2 years for an expansion pilot that this was going to be the year that we reviewed the data to determine if we kept funding it. But because we're having the gap for the AHEAD model, that money that was used for the pilot is going to the gap year, and everything that was piloted.
So we won't have the data to know whether.
We have the data.
We do have the data.
I've asked Blueprint to send the data, but it is not funded.
Yeah.
All right.
Yeah, and I'm happy to see that Jessa Barnard will be with you tomorrow morning for the details. I did put the hyperlink in my remarks to the data, because I know I've been with you before, and I know you really like to see that. And there's tons of data about Dulce. I just didn't want to overload you. And it is complicated to be talking about the mental health and substance use pilot as well as Dulce, but it really is that arm that's aware that there are some primary prevention success stories while we're talking about things that are impacting Vermonters right now in those arenas. Do you know? And
Yeah.
I think it's I think a lot of us, there's a lot of despair out there, and this Dulce approach is so hopeful. It's the yes and, right? You guys have a very hard job where you have to figure out how to fund crises and things happening right now. But these are those perfect new babies. And there's only 5,000 babies in the whole state a year. I think you are aware of that data point, but it's compelling because we really could get it right.
Would it be possible to, for you to get the information to us where the 9 sites are? How they're
That's also
distributed
in
around
my,
the state?
yeah, what we sent Kristen this morning has the map and it has stars
Oh, I
of
do see
what,
them. I'm sorry, I didn't
yeah.
get down that
Oh,
far.
no worries. No, and I also included a little graphic for why these 3 sectors. I think sometimes people feel why do you have early childhood, pediatric healthcare, and legal teams together? And there's a really nice schema. The part 2 from a policy perspective, you'll appreciate is if you meet every new baby and find out what's not working or what's not available in a community, it helps policy people in our state government to say, ooh, yeah, we have inadequate housing for new families in X town. So there's kind of it's a really nice, authentic way to wonder which communities have what families need and which are struggling through the lens of that new baby.
And do these Dulce sites, is there a collaborative approach along with our parent-child centers?
Yes, so that part I hope you love. The Parent-Child Center is the employer of the family specialists.
Okay,
So
all right.
in all my years, we've talked about why aren't human services more integrated with healthcare? And Dulce is exactly that. The person is employed across the street, we used to say. They go over on 1 day a week to do the care teaming and to do the children's integrated service connection, but they sit every day, all day in the medical setting to be a resource to families. So it leverages parent-child centers know so much about early childhood that pediatricians sort of know. I mean, but it's hard to keep up. So it's like this partnering love. And then the legal team, I'll just say so it's not confusing. We have a legal aid attorney who listens to the case review and provides consultation to the parent-child center and the pediatrician, not the family. So it provides this contextual, their brains just work so differently than healthcare people. And they'll say, gosh, did you just say that the new baby's father lives in California? Well, how's that going to work? What do we know about that? And it sort of sets up we need to attend to that and to be in service of this family. We need to know more about that. And the legal team points stuff out in a very consultative way. And then I thought what you were going to ask is we also provide quality improvement teams where that's my job, which is over at UVM now that I'm not in state government anymore. We meet monthly with the teams and we look at their data and we say 98% of the families in your practice accepted this service. It's so cool. All the families say yes. I'm not exaggerating. It is 98% of infants are in Dulce in a practice. A couple of families say, it's my 4th kid, I don't need this, or I'm moving to Texas next week, so don't bother. But it's an accepted service because it feels like they're on the newborn care team. It's not introduced as like, you're special down the hall, you need this lady. It's introduced as, I'm your physician, this is my care team member who's going to really help understand what your family's experiencing. So this is my passion thing. So I know we're at time and it's that late afternoon. I will stop.
So thank you, Dr. Holmes. We appreciate you coming in and
Great, and
reminding us
I'll-
what a great program this is.
Thank you so much. Appreciate all you're doing.
Thank you.
Thank you.
Thank you.
All right, I think we're done for the day, so we can go off.